Hello, in this video, we will be talking about increasing burden of mental illness across the globe. Mental health is a major health condition worldwide. It causes a significant burden to an individual and society across the globe. Mental illness are responsible for nearly 13% of the global burden of diseases. Most of the studies estimated the magnitude of burden by using various indicators such as prevalence rates, life expectancy, years of life lost, mortality rates, disability adjusted life years, and years lived with disability or YLDs. Nearly 80% of the people with mental disorders live in low and middle income countries, which account for more than 10% of the total burden of diseases in these countries. Stigma and discrimination. Stigma towards mental illness is known to occur globally. As per International Study of Discrimination and Stigma, outcomes on the global pattern of experienced and anticipated discrimination against people with schizophrenia. Anticipated discrimination affected 64% in the matters of applying for work and in training for education, 55% while looking for close relationship, and 72% felt the need to conceal their diagnosis. This unfortunately increases their marginalization, vulnerability, and indirectly causes burden to so family and society. Limited availability of medical health services. As a result of advancement in the understanding of biological basis of several mental illness, there are effective available treatments. However, these are rarely available to those in greatest need. In 80% of the low income countries, there are no anti-Parkinson's drug in primary care. In 25%, there are no anti-epileptic drugs. Unequal distribution of human resources between and within countries further weakens the access. WHO's European regions has 200 times as many psychiatrists as in Africa. Majority of mental health system in low and middle income countries are limited and often confined to hospitals with poor infrastructure. Financial burden. Healthcare systems have not adequately responded to the burden of mental disorders. As a consequence, the gap between the need for treatment and its provision is large all over the world. As per WHO's Mental Health Atlas 2011, annual spending on mental health per capita was 1.63 USD with large variation among different income groups, ranging from 0.2 USD in low income countries to 44 USD in high income countries. Globally, 67% of the financial resources are allocated to standalone mental hospitals, despite their association with poor health outcomes and human rights violations. Psychiatric, mental, neurological, and substance abuse disorders constitutes nearly 13% of the global burden of diseases, surpassing both cardiovascular diseases and cancer. Increasing burden is probably due to the lack of resources, low budget for mental health in low and middle income countries, underutilization of the services, and stigma attached to the mental illness. Mental illness are viewed to be more disabling than infectious diseases and cardiovascular diseases put together. The incremental efforts are required to address the burden of the mental illness and bridging the treatment gap. There is a need for a paradigm shift from finding the loopholes in existing mental health delivery system to developing cost-effective indigenous preventive measures and collaborative approaches to minimize the direct and indirect burden of mental illness. In this regard, in India, various strategies were adopted such as involving family members in mental health, integration of mental health into general health care, public mental health education, and mental health care for children and the elderly. Considering all these factors, it is time for respective governments and stakeholders to take much more serious notes about treatment and rehabilitation of the persons affected with psychological disturbance.